Good morning, everyone. Welcome to our first webinar of 2024. We hope that you all enjoy your holidays. My name is Robert Hersing, and on behalf of the Florida Alcohol and Drug Abuse Association, welcome to today's webinar entitled Florida Substance Use Trends Annual Update Report 2023. This webinar is being made available through a collaboration of the Florida Department of Children and Families and the Florida Alcohol and Drug Abuse Association. Please note that as an attendee, you are in listen-only mode and are only able to view your name. Your webcam and microphone have been disabled. If you have questions during today's webinar, please send them to the presenter and myself, the host, FATA Webinars, by using the chat panel. The button to open the panel is usually located on the upper right side of your monitor. Please use the chat panel to send us any questions you may have as you think of them. The presenter will address questions as time permits. Our audio is broadcast through the internet to your computer. If you experience poor computer audio at any time during today's presentation, there are a few options to try using the Communicate menu. One of these options is on the screen now, and all options are posted in the top of the chat panel. After ensuring that your volume, both on your computer and speakers, if applicable, is not lowered, you may click Communicate menu, then click the Audio Connection panel. Click Disconnect, follow the first two steps again, and then click Call in using computer and follow the instructions. If you continue to experience poor audio through your computer, try using the I will call in option under the Communicate menu. The access code and event password are on your screen and in the chat panel. You must be connected to the audio of this presentation as well as view it on screen to receive a certificate of attendance. We are unable to verify attendance if you are not connected to WebEx via your computer or mobile device. Therefore, audio-only attendees will not be eligible for a certificate of attendance or CEUs. The recording and materials used in today's presentation will be available on the FATA website within 30 days. To access the recording in PowerPoint, visit www.fata.org, navigate to the Resource Center, and click on Training Library as shown on the screen. FATA produces many webinars and workshops through the support of the Florida Department of Children and Families. To help participants track credits earned through attendance, we host an online community that provides a personalized digital journal where participants can maintain statements of credit for webinars and workshops taken through the Florida Alcohol and Drug Abuse Association. At the end of today's webinar, your web browser will direct everyone to an evaluation form on the FATA website. You will first need to register or sign in to your account to complete the evaluation. Please ensure that your name and email address match what you used when you registered for today's webinar. Information you provide FATA as part of registering remains confidential. Statements of credit will be posted within 30 business days after the evaluation closes in individual professional development journals for persons completing the evaluation and attending the entire webinar. Completing the evaluation is necessary to receive CE credits or to access your statement of credit. Please note that the evaluation will close at midnight on Friday, January 26, 2024. Up to 2 continuing education credits are available for participating in today's webinar for persons licensed through the Board of Nursing, the Board of Clinical Social Work, Marriage and Family Therapy, Mental Health Counseling, and for persons credentialed through the Florida Certification Board. If you are a licensed healthcare practitioner, be sure to include your Florida license number for reporting to CE Broker when you register with our site for the first time. If you are certified with the Florida Certification Board or licensed outside the state of Florida, you do not need to provide your certification number when you register with our site. Please note that WebEx monitors arrival and departure of attendees and provides a report upon completion of the event. We are not permitted to provide a certificate of attendance if you do not attend the entire webinar, nor are we permitted to provide partial CE credit. We encourage you to complete the evaluation for today's webinar as soon as possible. If you experience technical difficulties accessing the survey, please fill out a contact form at www.fata.org or email training@floridabha.org before the evaluation closes. This presentation is intended solely for educational purposes. The views, opinions, information, and content expressed in the presentation are those of the presenter and do not necessarily reflect the views, opinions, or policies of the state of Florida, the Florida Department of Children and Families, the Florida Alcohol and Drug Abuse Association, or the Florida Behavioral Health Association. Attendees should note that sessions are recorded and published in various media. Now I'd like to introduce you to our speaker for today, Ben Hackworth. Ben has over 5 years of experience providing community presentations, technical assistance, and training on substance use and mental health prevention services. As an independent contractor, he collects, analyzes, and evaluates data for local, state, and national dissemination through written reports and oral presentations. Ben previously contracted with the Center for Substance Abuse Research as a Sentinel Site epidemiologist for the National Drug Early Warning System, funded by the National Institute on Drug Abuse. Ben graduated with a Master of Public Health from the Northwest Ohio Consortium for Public Health, a joint collaboration between the University of Toledo and Bowling Green State University. His specialization is in health promotion and education. And now, Ben, I will turn it over to you.
Thank you so much, Robert. Good morning, everyone. I hope everyone's having a great morning so far. Again, my name is Ben Hackworth, and today I'll be presenting to you all the data from the annual update report for 2023 on Florida substance use trends. This is an update of the data and trends from the annual report that was published in June of last year. And this report will be available to you on FADA's website very soon. The PowerPoint slides that we'll be going over come from that report, and so I highly encourage most of you to go view that report, as there's more information as well in that report on FADA's website soon. So the objectives today are as follows. We hope that we can identify updates in substance use trends in Florida and the US, understand patterns of substance use regionally and statewide in Florida, and then identify substance use trends for fatal and non-fatal overdoses in Florida. As an introduction for the 2023 annual report update, this report offers new Florida data trends available after the release of the 2023 annual report issued in June of 2023. This report also presents information primarily for and about Florida, with a focus on youth trends and substance use misuse in Florida. This report will also provide an update on substance-related deaths from the Florida Medical Examiner's 2022 interim report published in July of 2023. The data sources from this report are from as follows. If you've attended these webinars before, you know that we utilize pretty much the same data sources, and I update you all on the data that we see here. And so the data sources that will be referenced in this report are as follows. The Center for Disease Control and Prevention, which gives us US drug death data. The Florida health charts can be found on the Florida Department of Health website. We use this data to look at drug, opioid, and emergency room visits in Florida. Towards the end of the PowerPoint, we'll go over the 2022 interim report from the Florida Medical Examiner's Commission for death data in Florida from January through June of 2022. And then lastly, the Florida Youth Substance Abuse Survey, or FYSAS, as I'll refer to it as in the rest of the PowerPoint, is a survey that assesses the risk and protective factors for substance abuse. The methodology for this report and for the PowerPoint are as follows. Again, we use the Florida Youth Substance Abuse Survey, which is administered every year. On the survey results for odd number years include state level data, whereas even number years include regional and county level data. So we have 2023 survey results, so we'll only be going over statewide data from the FYSAS. And then we have data from the National Survey on Drug Use and Health, or I'll be referring to it as NSDUH. And this is sponsored by the Substance Abuse and Mental Health Services Administration. So NSDUH data is combined data from 2 average years, which I can explain more when we get to that section. And then we have the Florida Health Charts, which again goes over morbidity from hospitalizations and emergency department visits in Florida. And we can also get some drug and opioid information from that website as well. And then lastly, again, the Florida Medical Examiners Commissions on drugs identified in deceased persons for the number of occurrences that we see in drug deaths in Florida. So the Florida Department of Children and Family Services, they contract with 7 regional systems of care known as managing entities to provide behavioral health services to people throughout the state. Because Florida is such a large, diverse state, this model allows each managing entity to respond to specific behavioral health needs in the region. So it's important for all of you on this call to know which managing entity that you belong in, and also for this presentation, because I'll be discussing some of the managing entities and the data that's related to each of them. In the blue shaded area in the Panhandle is the Northwest Florida Health Network. This serves about 7% of the population. And then in yellow is Lutheran Services Florida, which makes up Northeast and part of Central Florida in yellow. Central Florida Behavioral Health Network serves the largest population with over 6.1 million people. Central Florida Cares is in orange, serving about 13% of the population. We have Southeast Florida Behavioral Health Network, serving 10% of the population, shaded in pink. The Broward Behavioral Health Coalition, serving only Broward County. And then Thriving Mind South Florida, which only serves 2 counties, but makes up 13% of the state's population. So that's just a quick background of the managing entities and what we'll be going over towards the end of the presentation. So now that we have kind of an introduction completed, we can go straight into the data. So for at first, we'll be looking at NSDUH data for past year pain reliever use among adults in the US and Florida from 2015 to 2021. So as I said before, NSDUH data had collected data each year, but we're averaging the 2 years. So 2015 and 2016 single year data is combined and you get an average for those 2 years. So for example, 2015 to 2016 data, the prevalence of use among the US adults was at 4.5%, and the prevalence of use for pain reliever use in Florida was at 4.1%. Now, as you can see, there's a gap near 2020. And we all know what happened in 2020 and 2021. So there was a lot of survey incompletion during the COVID years. And so we only have single year data for 2021. Now, because of this, since we don't have 2-year averages and just a 1-year average for 2021, this data should be used as a caution when comparing 2021 data to the rest of the data that you see for NSDUH. So we'll proceed with caution when we look at NSDUH data, but for the time being, we can see here that for a past year pain reliever use, for the most part, it has been decreasing for both Florida and US adults. And finally, in 2021, the rate was 3.2% for US adults and 2.5% for Florida adults. Now switching over to the FYSAS. For lifetime and past 30-day pain reliever misuse among youth in Florida, we have the graph here from 2010 to 2023. Pain reliever misuse among middle and high school youth in Florida has continued to decrease. There's a 67% decrease in lifetime pain reliever misuse among youth in Florida from 2010 to 2023, and a 68% decrease in the past 30 days. In 2023, this was the first year past 30-day use has dipped below 1%. And past 30-day use is also considered current use. So I'll use those words interchangeably. For for past year pain reliever misuse among youth, according to the NSDUH data, again, we'll proceed with caution since according to the data, there was a increase in 2021. But again, with the regular data that we saw from 2015 to 2020, we see this decrease in both Florida and the US. So again, we just want to use caution when we compare the single-use data for 2021 compared to the previous 2-year average data. We can look more in detail for the with the FYSAS data that we have and separate middle and high school youth and their lifetime and past 30-day prescription pain reliever use. So when we look at middle school versus high school youth trends, the sharpest decrease is among lifetime use among high schoolers in yellow. The orange line represents middle school youth, which had a slight increase in 2022, but then decreased to 2.6%. And this is slightly higher than the high school lifetime use. Past 30-day use for both middle and high school youth in the blue and gray line shows similar trends with 1% of middle school youth using pain reliever versus the 0.8% of high school youth using prescription pain relievers. So according to this data, we have middle school youth using at a slightly higher rate than high school youth. Again, we can separate and get more in detail with this data. And we can look at female versus male youth data. So this is middle and high school female and male youth combined. And so we see here that prescription pain reliever use among females is higher for lifetime and past 30-day use. The female lifetime line is in blue and the female past 30-day use is in gray. So these are both showing you that the prevalence among females is higher for prescription pain relievers. The difference is that females have a 3.1% lifetime use versus a 1.8% lifetime use for males, and a 1.2% past 30-day use versus a 0.6% use for males. Okay, for the next substance, we'll be going over heroin use. This is from the NSDUH data. We're looking at Florida versus the US among adults. And heroin use among adults has kind of been like a roller coaster of increases and decreases throughout the years. However, the rates have stayed generally very low, between 0.4 to 0.3% for US adults and 0.3 to 0.2% for adults in Florida. When we look at past year heroin use among youth in the US and Florida, um, the rates are very low. We see a drastic decrease from the graph, as you can see here. And the graph shows that data for 2019 to 2020, and then 2021 alone came out null, which just means it basically has a value of 0. So very low numbers for past year heroin use among youth in Florida and the US. For lifetime past 30-day use of heroin among youth in Florida, according to the FYSAS, is shown here. We see again pretty low numbers for youth in Florida using heroin for lifetime and past 30-day use, with 0.2% of youth using in the past 30 days for the third year in a row, and then another 0.1% decrease in lifetime use in blue for 2023 at 0.3%. Past year cocaine use among adults in the US and Florida is shown here by the NSDUH data. Cocaine among adults in the US and Florida had its peak between 2017 and 2018, with 2.26% of US and 2.13% of Florida adults using cocaine in the past year. Now, among youth for cocaine use, we see a more steady decline. And NSDUH data shows that there's been a definite decrease in cocaine use in the past year among US in blue and Florida youth in the orange, with 0.1% endorsing cocaine in 2021. When we look at the FYSAS data for cocaine use among youth in Florida, past 30-day use has had a slower decline than lifetime use, although past 30-day use is already pretty low, with only 0.3% of youth using cocaine in the past year, and 0.7% of Florida youth using cocaine in their lifetime in 2023. Past year methamphetamine use among adults in the US and Florida is shown here from the NSDUH website. Florida adults in orange has been using methamphetamine in the past year has been basically a zigzag between increases and decreases every other year, whereas methamphetamine use among adults in the US has seen a steady rise. Past year, methamphetamine use among youth in the US and Florida from the NSDUH is shown here. We see the highest use between the 2017 and 2018 averages at 0.18 and 0.15% for the US and Florida, respectively. And then we see that while 2021 saw a slight increase in use for both the US and Florida as well. When we're looking at the FYSAS data for methamphetamine use among youth in Florida, we see pretty steady rates, at least for past 30-day use. For lifetime use, it continues to decrease since 2020, after a slight increase was observed for that year. We see a 0.1% increase for past 30-day use in 2023 among youth in Florida. Past year marijuana use among adults is shown here from the NSDUH data, and we can see a steady incline for marijuana use among adults. So marijuana use continues to increase for US and Florida adults throughout this time period listed on the graph, with 19.5% of adults in the US and 15.4% of adults in Florida using marijuana in the past year. As far as past month marijuana use, we've seen similar trends as past year use that we saw in the previous slide, with the US adults having a slightly higher prevalence rate at 13.7% and 11.2% for Florida adults. So I think it's pretty obvious that some reasons for the steady increase in both these slides could be legalization and the perception of harm is decreasing for marijuana use as well. However, on the contrary, past year marijuana use among youth has slowly decreased for the most part. It's not as sharp as a decrease in prevalence rates, but nonetheless, we have the decrease versus the increase that we saw among adults, with 10.4% of youth in the US using marijuana in the past year, and then 9.3% of youth in Florida using marijuana in the past year. Again, from the NSDUH data, seeing similar trends as the previous slide for youth. Past month marijuana use among youth for both Florida and the US are shown here with a slight decrease among across the years. Florida has lower past month use than that of the US in this graph, with 3.9% versus 5.7% for the US. For the FYSAS data, we see pretty similar trends with this data as we saw with NSDUH data, where we're slowly decreasing for marijuana use among Florida However, the sharpest decrease can be observed between 2020 and 2022. Following that 2023 survey year indicated another decrease in use for both lifetime and past 30-day use at 14.2% and 7.4% respectively. When we look at marijuana use among female and male youth in Florida, lifetime use among females in blue is interesting because we see basically the same prevalence rates up until a decrease in 2022. And this is shown for the lifetime prevalence rates falling just under 20% for the first time and leading to another decrease in 2023 with 16.3% of lifetime use among females in Florida. However, the prevalence rate is much higher than their male counterparts at only 12% for lifetime use, which you see there in the orange. Similar trend lines that we see here for past 30-day use among males has slowly decreased with the prevalence rates just falling at 8% for past 30-day use. And then for female rates, it's at 6.7%. When we look at marijuana use among middle and high school youth in Florida from 2012 to 2023, as you can imagine, marijuana lifetime and past 30-day use is much higher than among high school youth than middle school youth, with 19.7% using in their lifetime and 10.2% using in the past 30 days. Current use and lifetime use for middle school youth saw an increase, though, from 2022 to 2023, from 3% to 3.7% for past 30-day use, and then 6.6% to 7.1% for lifetime use. So we see a slight increase among middle school youth using marijuana. Now we'll get into vaping. So survey questions on the FYSAS about vaping didn't come out until a few years ago, and they separated the questionnaire even more to be more specific, whether youth are vaping nicotine or vaping marijuana. And so this survey question appeared in 2019. So we only have a few years of trendline data to compare, but as you can see here, as far as vaping nicotine, it's slightly decreasing, with sharper decreases occurring after 2021. In 2023, lifetime use was under 20% for the first time, and past 30-day use was at 7.8%. And something to that's kind of noteworthy is that vaping nicotine is more common among youth in Florida than vaping marijuana, which we'll see in the next couple slides. And also, vaping nicotine is the second most common substance to use among Florida youth, right after alcohol. So if you remember, we just talked about marijuana. The rates for vaping nicotine are higher among Florida youth than they were for youth using marijuana. So After alcohol, this is the second most common substance for youth in Florida to be endorsing and, saying that they're using either in their lifetime or past 30 days. Also, according to the Monitor the Future survey, vaping nicotine is the also second most common substance to use among youth in the US. And so these trends are very common for other US youth as they are here in Florida for youth to use nicotine in a vape device. When we look at vaping nicotine among middle and high school youth in Florida, we see a steady decline for high school youth in the yellow line, which unlike the high school youth, continue to decrease in past 30-day and lifetime use of vaping. Middle school youth actually saw an increase in lifetime and past 30-day use in 2021. These are the orange and blue trend lines. The rates decreased in 2022 and 2023, except for lifetime use in 2023 with a 0.1% increase. Just under 20% of high school youth have vaped nicotine in their lifetime versus just under 10% of middle school youth vaping nicotine in their lifetime, according to the 2023 results. Among females and males in Florida for lifetime and past 30-day use of vaping nicotine, we see an increase in 2021 among middle school youth as we saw an increase in 2021 among middle school youth in the previous slide, we see that lifetime and past 30-day use in blue and gray increased in 2021, whereas male lifetime and past 30-day use has steadily decreased. Something noteworthy is the difference between lifetime use among females versus males. So lifetime use in blue versus male lifetime use in orange. So in 2023, 20% of females said that they vaped nicotine in their lifetime versus only 12.9% of males said that they vaped nicotine in their lifetime, which is a difference of 7.2%. So this is a kind of an interesting percentage to look at and see that there's kind of a big gap between male and female lifetime use. Just from 2021 to 2023, males are decreasing lifetime use of vaping nicotine by 33%, whereas the percent change among females is only at 22%. So there's been a sharper decrease among males for vaping nicotine versus females. So I think this is kind of an interesting slide to kind of take note of. As I said in the previous couple slides, the survey also asks about vaping marijuana. And we see the rates for vaping marijuana are lower than vaping nicotine, as it's more common to vape nicotine among youth versus marijuana. Other than the slight increase in lifetime use in 2020, rates are declining for vaping marijuana. To compare these rates to nicotine from the other side, lifetime use is 16.6% versus 11.8% shown here. And past 30-day use is 7.8% versus 6%. for past 30-day use. So again, more common for vaping nicotine. For for vaping marijuana among middle and high school youth, vaping marijuana is more common among high school youth, shown in yellow. And the gray trend line also is 30-day use for high schoolers. Past 30-day use among middle school youth in blue has seen an increase in use in 2022 and also in 2023. Lifetime use for this age group has also increased in 2023. So this is another substance that we're seeing increases among middle school versus high school youth. Now comparing female versus male youth in Florida. Males had higher rates in 2019 for past 30-day use in yellow, and the exact same rates in 2020. However, the following year, females began increasing their past 30-day use rates, while males were decreasing their rates. Lifetime use among females has always been higher, with the highest rate shown in 2021 at 16.8% versus 13.1% for males. Now going on to alcohol use. From the NSUH data, past month alcohol use among adults in the US and Florida is shown here. Past month alcohol use among Floridian adults had quite the decline from 2015 to the two-year average of 2017 and 2018. Rates rose again the following survey cycle, but in 2021, the single year survey data, which should be compared with caution, shows quite the decrease in alcohol use. This is a similar trend for the US as well. I have done a lot of research on alcohol use, especially during COVID, and there's a lot of literature out there saying that alcohol purchasing and use has increased since COVID, especially during lockdowns. So again, I just want to caution comparing the single year 2021 data to the rest of these the survey percentages that you see here on this graph. Because the research out there is showing that alcohol use most likely should have increased instead of decreased for this year. Um, we'll We'll be waiting on more updated NSDUH data for 2022 so that they can compare the data when we get new survey results soon. You can also look at binge alcohol past month use among adults in the US and Florida. And we can see here that binge alcohol use among adults in the US and Florida has decreased over time. Florida has had higher rates up until the two-year average of 2017 and 2018. And then the most recent survey in the US had 23.2% of adults binge drinking in the past month versus 21.7% of Florida adults binge drinking in the past month. As far as youth data goes for past month alcohol use, we see the trend lines here for the US and Florida. For youth in the US, it saw its peak at 10.1% between 2017 and 2018 survey data. And the survey year before was the highest for Florida at 9.5%. So we see a slow decrease observed with the recent data showing 6.9 and 6.6% of alcohol use for the US and Florida, respectively. When we look at lifetime data for youth in Florida, alcohol use is the most prominent substance to use among youth in Florida. Prevalence rates for the past 30-day and lifetime use has decreased since 2010. There's been a 45% decrease in lifetime use and a 61% decrease in past 30-day use from 2010 to 2023, which is a pretty good decrease in for the substance. And in 2023, percentage rates had fallen just under 30% for lifetime use and was at 11% for past 30-day use for alcohol. Among male versus female youth in Florida, from 2012 to 2023, alcohol use has been higher among females for both lifetime and past 30-day use. This is shown in the blue and the gray trend lines. Females are using at a 30% lifetime use versus 25% for versus male counterparts. And for 30-day use, females are using at 12% versus 9%. So again, we see females using at higher rates than males. Looking at middle school and high school youth for alcohol use, obviously this substance is more common among high school youth, which you see here with high school lifetime in yellow and past 30-day use in gray. As high school youth, lifetime and past 30-day use has continued to decrease since 2012. Middle school youth saw a snag in its rates and had an increase in both lifetime and past 30-day use in 2020. However, 2022 and 2023 survey results show a decrease from 2020. So we saw a little increase in 2020 for middle school youth, but it's going back down. When we look at binge alcohol use among youth in Florida and the US, this has seen a slight decrease since 2015. And in 2021, rates fell below 4% for both the US and Florida youth. From the FYSAS, we see the data here from 2010 to 2023. And the survey defines binge drinking as having 5 or more alcoholic drinks in a row in the past 2 weeks. And we see the decrease from 14.1 to 4.8%. And this is a 65% decrease from 2010 to 2023. We see the difference between middle and high school youth for binge alcohol use. And use among high school youth is higher among middle school youth, with high school youth trend lines having seen a sharper decrease with the trend lines in orange, versus middle school students have stayed pretty consistent with a slight decrease across the time frame shown in this graph. We just see a 0.2% increase in 2023. Among females and males, starting in 2014, female youth in Florida had shown higher rates of binge alcohol use versus male youth in Florida, with only a 0.1% difference in 2014 and a 0.2% difference in 2016. In 2018, male usage was slightly higher than female use at 6.9 versus 6.7%. And then in 2020, the gap began to widen for female and male prevalence rates for binge alcohol use. In 2023, females reported a 5.2% use rate, and males reportedly partook in binge alcohol use at 4.4%, which is a 0.8% difference. When we look at club drugs, this is a question in the FYSAS. And these club drugs earn their name by being a group of substances commonly used by youth and young adults at parties, entertainment venues, concerts, nightclubs. Their club drugs are usually mixed with they're a mix of drugs from a variety of classes. Some could be classified as LSD, ketamine, GHB, MDMA, or ecstasy. So it's kind of a mixed bag of drugs that's classified under this umbrella term. And with that being said, club drug use in Florida has been decreasing since 2010 for lifetime and past month use. However, a sudden increase in prevalence occurred for both past month and lifetime use in 2019 and 2020, respectively. In 2023, FYSA survey results show that club drug use among youth decreased in Florida. So although there was a increase in 2020, we're seeing a decrease still in club drug use. And then lifetime and past 30-day use for inhalants is shown here. Inhalants are referred to as various household products, such as solvents and aerosol sprays, that are only used through inhalation. And inhalants are primarily used by children and youth, and inhalants are the only substance used more often by children than adults. Thus, we only see inhalant use data among youth reported here, and according to the FYSAS, lifetime and past 30-day use has decreased from 2010 to 2016, whereas an increase in 2018 occurred along with another increase in 2020, with 6.5% of youth using inhalants in their lifetime and 1.9% using inhalants in the past 30 days. However, since 2020, prevalence rates have decreased to 5.3% and 1.5% for lifetime and past 30-day use, respectively. Lifetime and past 30-day use of inhalants among females and males is shown here. Inhalant lifetime use among females is 2.3% higher than male lifetime use. at 6.4% versus 4.1% in the blue and orange trend lines. And this is a wider percent range than that of the 30-day use, with females using at higher rates at 2% versus 1%. Now, when we compare middle and high school youth in Florida for inhalant use, um, this is interesting to look at because inhalant use among middle and high school youth um, is a little more noteworthy because this is probably the only substance where middle school youth have higher prevalence rates than high school youth. So you see middle school lifetime in orange um, being higher than high school lifetime in yellow, and also middle school past 30-day use in blue being higher than high school 30-day use. So again, we see similar trends with an increase in use across the board starting in 2018 and also in 2020. But in the previous graph, there was a decrease from 2020 to 2023. Again, however, this is probably the only substance where middle school youth is using more than high school youth. As I said before, it's definitely more common among children than a more mature high school student using any solvents or aerosol sprays to use either in the past 30 days or in their lifetime. So this is probably the only substance that is higher for middle schoolers. And I think this would be a good break from the slides. If Robert, you want to take over to have a 5-minute break?
Absolutely. All right, guys, we'll take a 5-minute break. It's currently 10:57, so we will be back right at 11:02. So 11:02, we'll be back and get started. All right, Ben, are you ready to get started?
Yes, I am.
All right, perfect.
Awesome. Okay, welcome back, everyone. Hope you had a quick break to maybe get coffee or use the restroom. Um, so just want to reiterate what we went over so far. So we've gone over a lot of um, youth and adult data from FYSAS and the NSCUH data. Um, I saw some questions in the chat. So this is self-reported data from both of these reports that I get the data from. So just wanted to let you know about that. And then the next section of this presentation, we'll be going over morbidity and mortality rates in the US, but mostly in Florida. Um, let's see. So Robert, can you put yourself on mute? Sorry. Okay, and then so we'll be going over some data from the Florida Department of Health, which provides a dashboard for substance use data, such as emergency department visits due to non-fatal drug overdoses. And this is from 2015 to 2022. This is just the recent data that we have is 2022. So the number of visits is collected and shown here. The trend line mirrors the opioid drug death epidemic with peak visits at the time in 2017 to then continuously increase after 2018. The latest non-fatal overdose emergency department peak in Florida was seen in 2021 with just over 50,000 emergency department visits. Now in 2022, we see a decrease of around 5,000 visits from the previous year, making this the first decrease in emergency department visits since 2018. However, even though we do see a decrease, the number of emergency department visits for non-fatal overdoses is still one of the highest numbers we've seen in the past few years. Now, when we look at specifically opioid involved non-fatal overdose emergency department visits, we see a similar trend line as we saw in the previous slide. And this graph again, we at the time in 2017 was the peak at 18,000 emergency department visits for opioid involved non-fatal overdoses. And then there was a decrease in 2018, just as we saw in the previous slide. However, the amount of emergency department visits has steadily increased with its peak in 2021. But with 2022 data, we see that there was a decrease from 2021 with just under 20,000 emergency department visits for opioid involved non-fatal overdoses. So for the previous slide, that was morbidity, and now we're going into mortality. So this slide, unfortunately, we don't have full 2022 data, but I'm going to be referring to this slide in the next couple slides as well. But as you can see here, this is fatal drug overdose deaths in the US and Florida from 2015 to 2021. In 2015, Florida had actually a lower death rate than the US. However, starting in 2016, we see here in the orange trend line that Florida has had a higher drug overdose death rate than the US since 2016, with the rates continuing to increase after 2018. So the next two slides will closely look at January through June all drug and opioid death data in Florida. So for Florida, we only have the first half of 2022 data so far, which is January through June of 2022. And Florida had 3,776 drug overdose deaths. Just by doubling this number, we can estimate that for all of 2022, we could see 7,552 drug overdose deaths in Florida. So we can just estimate by doubling this number that we'll see about 7,500 drug overdose deaths, which would be a decrease from 2021. And again, just doing some simple math with the total drug overdose deaths in Florida and the population rate, I'm speculating that we could see a decrease in the overall death rate in Florida that we see here in this slide. So I'm predicting that we'll see a decrease in drug overdose death rates for the US, or sorry, for Florida in 2022. With the help of the data from this slide. Just doing some preliminary calculations. I'm predicting a death rate at about 35.0. Again, looking at this slide, that would be about the same as the rate, the death rate as it was in 2020, but still a decrease from 2021. So, so far, even though we only have the first half of data for 2022, I'm assuming that we'll see a decrease in drug overdose deaths for all of 2022, which is really good news since we've seen such an incline in overdose deaths since 2018. And with the help again from Florida Health Charts and their data that they provide, we can look specifically at fatal opioid overdose deaths in Florida. Again, we only have the first half of 2022 data. But we see that the trend line is similar than that of the previous slide. And we see the peak in 2021 with 6,442 fatal opioid overdose deaths in Florida. Now, for the first half of 2022, we see just over 3,000 opioid overdose deaths, meaning that if we just double this number to get a full year estimate, we would see about 6,000 fatal opioid overdose deaths in Florida, just from opioids specifically. Again, this would estimate that we could see a decrease in opioid overdose deaths in Florida from 2021 to 2022. So I speculate by the time we do the annual report in June and the webinar, we'll have more updated data for you all, and hopefully we'll actually see a decrease versus me just giving you an estimate of what I believe we'll see. So This is really good news for Florida, as we're hoping to actually see a decrease in drug and opioid overdose deaths for 2022. So that was data from the Florida health charts, which I highly encourage all of you to go on their dashboard and look at the data. But now we're going to move on to the medical examiner's report, and we're going to look at the number of occurrences that we see in their reports. And so I just want to reiterate what the number of occurrences is. And so um, at the time of death, a decedent can have um, drugs that are either the cause or present during the time of death. And so they count these as occurrences. We have the prescription opioid occurrences among decedents in Florida among managing entities shown here. And this again is only the first half of 2022 data. So from January through June. And we look at prescription opioids mostly because we know that this started the first wave of the opioid epidemic with overprescribing, misuse, and in turn abuse of prescription opioids. And there's three specific prescription opioids that the medical examiner looks at, which is oxycodone, hydrocodone, and methadone, which is outlined here. And so this is highlighted in the medical examiner reports. And combining these prescription opioids are outlined here among the managing entities and can also be compared to each other as well. So based on rate per 100,000 population, prescription opioid related deaths are shown here. The lowest rate was 1.7% in the Thriving Mind South Florida region, and the highest rate was 7.1% in the Northwest Florida Health Network region. When we look at heroin-related deaths among decedents in Florida from 2012 to the first half of 2022, we see that the trend line here looks like a bell curve, and we know that heroin contributed to the second wave of the opioid epidemic with an increase starting in 2015. And even 2013, we see like the start of the increases starting as well, and reached an all-time high in 2017 with 1,057 heroin-related deaths. The first decrease occurred in 2018 and then remained stable in 2019. And then there was a slight decrease in the number of heroin-related deaths observed for 2020. And then there was a dramatic decrease appeared in the number of occurrences in 2021, with 464 heroin-related deaths in Florida. For the first half of 2022, we see here that there were 120 heroin-related occurrences, which means for 2022, we could estimate about 240 heroin-related deaths, which is another decrease. Looking at heroin-related deaths among decedents for the managing entities, we see here the number of occurrences for each managing entity, with Southeast Florida Behavioral Health Network having the highest number of occurrences at 32, and Thriving Mind only at 2 occurrences. However, since we should look at the rate per 100,000 population, we still have Southeast Florida Behavioral Health Network having the highest total number of occurrences, and also the highest rate. Whereas Thriving Mind South Florida had the lowest number of occurrences and also the lowest rate at 0.6% per 100,000 population. Okay, now looking on to fentanyl and fentanyl analog related deaths among decedents in Florida from 2012 to the first half of 2022 is shown here. We know that a lot of the increases in overall drug overdose deaths has been attributed to synthetic fentanyl, which began the third wave of the opioid epidemic. Fentanyl and fentanyl analog related deaths increased dramatically starting in 2015. The sharpest increase for fentanyl and fentanyl analog related deaths in Florida occurred from 2019 to 2020, with 7,785 fentanyl and fentanyl analog related deaths. For 2021, there were 9,218 fentanyl and fentanyl analog related deaths in Florida. And for the first half of 2022, the total number of fentanyl and fentanyl analog related deaths were 3,506 occurrences. An estimated 7,012 total deaths, total number of occurrences in 2022 could occur, which would indicate a first increase, which could indicate a decrease from 2021 to 2022. So this graph could be really important for why we're seeing decreases from the previous slides, as I had been mentioning with the death rate for Florida. We know that fentanyl has been driving the death rate in Florida and the US. And so with this estimated decrease in the number of occurrences among decedents in Florida alone could be, kind of the driving factor for why we're possibly seeing a decrease in our death rate, which is really good news because, we've seen such high increases in our death rate and among fentanyl and fentanyl analog related deaths in Florida and the US. And so cross our fingers that we'll actually see the numbers come true in 2022, as we only have preliminary data. And so even though we're possibly going to see a decrease, I mean, these are still pretty high numbers. But again, a win's a win, hopefully, at the end of the day. So I think we're seeing the decrease because there's been a decrease in fentanyl and fentanyl analog occurrences as well. For the managing entities with fentanyl and fentanyl analog related deaths, for the first half of 2022 is shown here. Occurrences for both fentanyl and fentanyl analog related deaths was highest in Central Florida Behavioral Health Network region with 1,313 occurrences, and the lowest total number of occurrences appearing in the Thriving Mind South Florida region. Based on 100 rate per 100,000 population, Central Florida Behavioral Health Network region has the highest rate per fentanyl and fentanyl analog related deaths in Florida, with a death rate of 21.5. The lowest fentanyl death rate was 6.4 in the Thriving Mind South Florida region. When we're looking at cocaine related deaths among decedents in Florida, rates of cocaine caused deaths in Florida has been consistent with the rest of the trend lines, and we see the increase starting in 2015, although the number of occurrences have always been pretty high for cocaine. And there was a sharp increase in 2020 and then another one in 2021 with a total of 4,015 cocaine related deaths in Florida. For the first half of 2022, if we double the first half of the number of occurrences of 1893, this estimate would be about 3,786 cocaine-related deaths in Florida for all of 2022. And although this estimate reflects a slight decrease for 2022, it's still pretty high and would be the second highest right after the 2021 number of occurrences. For the managing entities, we see the breakdown here for cocaine-related deaths for the first half of 2022. The highest total number of cocaine-related deaths occurred in the Central Florida Behavioral Health Network with 525 occurrences. The lowest number of occurrences was reported in the Northwest Florida Health Network region with 100 occurrences. Based on the rate per 100,000 population, the highest cocaine-related death rate in Florida was in the Southeast Florida Behavioral Health region at 11.9, and the lowest cocaine-related death rate was in the Northwest Florida Health Network region with 6.5 rate per 100,000 population. Now we have methamphetamine-related deaths in Florida from 2012 to the first half of 2022. This has seen more of an increase every single year, as we see here from the chart, and the number of occurrences has dramatically increased every single year, especially since 2016, with the biggest increase in the number of methamphetamine-related deaths occurring in 2021. We see the height of methamphetamine-related deaths in 2021 with just under 3,000. And for the first half of 2022, there were 1,445 methamphetamine-related deaths in Florida. This estimate for all of 2022 would mean that there would be 2,890 methamphetamine-related deaths after doubling the first half of 2022 data. Again, this would indicate another slight decrease in from 2021, which is also good news since we've seen such a huge increase in the number of methamphetamine-related deaths. But again, this number is still pretty high, the estimate number. Um, so although again a small win, um, we're most likely going to see a decrease, but still pretty high numbers for methamphetamine related deaths in Florida. And then for the managing entities, looking at methamphetamine, the numbers are distributed here among the regions. The highest number of methamphetamine related deaths was 526 in the Central Florida Behavioral Health Network region. The lowest number of occurrences were in the Broward Behavioral Health Coalition with just 29 occurrences at the time of death. And based on the rate per 100,000 population, the highest rate for methamphetamine related deaths among the managing entities was in the Northwest Florida Health Network with 14.2 with a 14.2 rate per 100,000 population. The region managed by Thriving Minds South Florida had the lowest methamphetamine related death rate with 1.2 per 100,000 population. So that was a look at the death rates and the different substances that the medical examiner looks at. And so just in conclusion, out of everything that we've gone over, I know it's a lot of data and I know it's a lot of information to kind of digest, but just in conclusion and some highlights that I wanted to go over for you all. Alcohol use among US and Florida youth has continuously decreased since 2010. And alcohol use among middle school youth in Florida has slightly increased in 2023. Marijuana use among youth has continued to decrease in recent years. And vaping, nicotine, and marijuana among youth remains steadily decreasing. However, vaping nicotine is still a top substance for youth nationally and also in Florida. Emergency department visits in 2022 decreased for the first time since 2018. And from the Florida Medical Examiner's interim report, the numbers may indicate a decrease in drug overdoses since 2018, which is hopefully a good sign for our overall drug and opioid death data. And hopefully we'll have updated data and numbers for you all for 2022 in the next webinar. And I'm going to hand it over to Robert. And these are my references again that I've gone over today. I just want to thank everyone for their time and attention. Thank you.
Thank you, Ben. There are a few questions here in the chat. I'll just kind of read them off to you. Um, One person asked if students complete the Florida Youth Substance Abuse Surveys at school or where that data comes from.
That I'm not sure of. I thought they did it at school, but I think with the 2020 survey, I think it was done differently. I'm not sure about that question actually.
Got it. The next person asked how 2022 decreased so much for fatal overdose deaths. Do you have any thoughts about that?
No, that's a good question. I've been kind of racking like my brain around that as well. I think we'll need more uh, data and literature reviews to kind of see what's going on. Is it a supply issue? Is it a demand issue? Is the potency going down? Are we more equipped to respond to overdoses and you know, helping people as their treatment? There's so much more um there's so many variables that play into it that um I can't give like one straight answer just yet, just because it's so early. We've seen a push for treatment, we've seen a push for more Narcan. Um, there's there's so many there's also been a push for syringe exchange in Florida now. So yeah, there's a lot of avenues that it could be attributed to, but either way, the possible decrease is really good news for Florida.
Absolutely. Do opioid overdose deaths include heroin?
Yes,
Perfect. And do you know if there's any data on naloxone uses to save lives?
that's yeah, that's tricky because there is some data out there. However, not everyone records or reports their data on naloxone use. So, um, you could have someone, a first responder, you know, give out naloxone, have to use it um, at a scene, and they might not report or record that they used or how much they used. So that's pretty difficult to really give out numbers on um, on naloxone usage, but there is some data that um, some first responders have, but it's pretty protected as well. I don't know if there's a lot of um, availability for us to use, but that's a good indication of how much is being used and so forth.
Got it. Two more questions. One person asked if you have any idea of the specific reasons identified for Central Florida having significantly higher death rates.
Um, well, overall, that region is pretty big. Um, and so we just have a sheer amount of uh, total deaths in that region. As I mentioned before in the presentation, like 28% of the population is coming from that region. So just overall, this it's a really big region. But as far as if there's a specific reason why in that region, I don't know.
Perfect. And then the last question is for the methamphetamine deaths amount, the managing entities. Do those numbers come from data reported in that area or are they specific to ME funders? Do you know?
Wait, can you repeat it? Sorry, I was seeing some of it.
Yeah. Somebody asked for the methamphetamine death rates from the managing entities. Where do those numbers come from? Was it deaths reported in that area or is it data specific to ME funded persons?
Oh, got it. The managing entities comes from the uh oh my gosh, why am I blanking? The Florida Medical Examiners Commission's data. And so it would be the medical examiner from each region.
Got it. Awesome. Well, thank you so much, Ben. I do see a question here about when the report will be available, the annual update report. I would advise everybody to look for that sometime in February. We are finalizing that now. So we will disseminate a notice once that has been published. You'll receive an email in the same way you receive an email when there is a upcoming webinar or workshop. We will send out email that says the report is available for viewing. So once we have that information, we will send that out. I would expect probably about mid-February. Please hang on for just a moment for some conclusion items. Thank you, Ben, for your time and for the information. We've included Ben's contact information here if you have any additional questions about today's webinar. I'm going to put a link to the survey in the chat. Once you once I close the webinar here in just a moment, you will also see your internet browser pop up and ask if you would like to be redirected to the survey. Please go ahead and click yes. It'll take you right to the survey. You can go ahead and complete it first thing. When you go to access the survey, you will be prompted to sign in or register to complete the evaluation. If this is your first webinar with us, you can register as a visitor at no cost. You can do so by clicking haven't registered yet. You must use the same email address you used when you registered for today's webinar when you register for the FATA website. That is the only way to connect your attendance and your profile. After you register or sign in, you will be directed onward to the evaluation. You will also get an email later today with a reminder to complete the evaluation along with a link. For CEs to be reported to CE Broker for Florida licensed healthcare practitioners, you must provide an accurate Florida Department of Health license prefix and number the first time you register. If you need to add or update your license number, you may do so by logging in and clicking Edit on the Professional Information section of your profile. As a reminder, the evaluation will close at the end of the day on Friday, January 26, 2024. If you experience difficulty logging into your account or accessing the survey, you may contact FATA's team either by filling out a contact form on our website as shown on the screen, or by sending an email to training@floridabha.org. Please be sure to try and complete the survey as soon as possible and reach out to us before the evaluation closes if you're having any difficulty. We do not email statements of credit. Instead, after we verify attendance and completion of the evaluation, a statement of credit will be generated as a journal entry within your profile within 30 business days after the evaluation closes. As a reminder, the recording and materials used in today's presentation will be available on the FATA website within 30 days. To access the recording in PowerPoint, visit www.fata.org, navigate to the Resource Center, and click on Training Library as shown on the screen. Thank you again for participating in today's webinar. Thank you again, Ben, for your time and your information. We'd also like to recognize and thank the Florida Department of Children and Families for funding today's education. Have a great day, everyone, and please hold for the evaluation.